Please welcome to the stage our next panel, The Future of Beauty, Science, Skincare, and Aging Well, moderated by the host of Well with Arielle Laurie.
How's everyone doing? I'm Arielle Laurie, and I'm so excited to talk about some of my favorite topics today with some of my favorite people. So we're going to be talking all about beauty and aging and longevity with who I consider to be some of the best in the business. So welcome, Tony and Amy. So happy to have you guys here. Why don't you introduce yourselves to the audience?
Yeah. Hi, I'm Amy Chang. I've been in the beauty space for over 10 years. I like to call myself a beauty expert, researcher. I'm just a woman who is on the hunt for the best in beauty and loves sharing it with all of you.
My name is Dr. Tony Yoon. I'm a plastic surgeon in Detroit. And I have written 4 books. I'm a lot on social media. I've got my own podcast, The Dr. Yoon Show, and I love talking about holistic ways to turn back the clock using surgery as only a last resort.
Welcome. And
you.
2 of my favorite past podcast guests, I have to say. What is the right age for people to start with preventative treatments? I know that there's a lot of confusion around that. And like you said, it is a personal choice, so nobody has to be doing anything. But you hear, preventative Botox in your early 20s, facelifts in 30s now. Like, from a surgical standpoint, is there like a window where you get the best result?
So I think that as far as when you start, I'm not a fan of prejuvenation with Botox, like the whole doing it before the wrinkles, because I have seen patients in my practice where they get resistant to Botox after a while. In which case, like when you don't need it and you're getting it done, let's say you're in your even teens and 20s, and then you actually do find that you're in your 30s and 40s and you can benefit from it, and now it doesn't work because you shot your proverbial, wad too early. That's, I think, my main issue with it. And it's a medical procedure. It's expensive. I don't know if you have any
But good thing there's space tape, right?
There you go.
Amy, what do you think?
I think as early as you can start with prejuvenation is incredible. Like, my daughters are 4 and 7, and I teach them to wear sunscreen every single day. We have a basket by the door that has sunscreens, it has hats, and they know before we leave for school in the morning, they stop at the basket, they put their sunscreen on, they grab a hat, and they're out the door. And then the second thing is I've taught them how to wash their face at night with a gentle cleanser to properly remove that sunscreen. That's it. That's all they need to be doing and learning and building that muscle memory to do it, so that, then when they're older, they're not even thinking about it. They're just like, oh, this is what I do. And so by the time they get to their 30s and 40s, they're not going to have to be doing a lot of rejuvenation because they did so much preventative care for their skin. As we enter different phases of our life, the prejuvenation is different. So when you're a teen, again, you want to keep it simple. Sunscreen, proper cleansing at night to properly remove that sunscreen. If you're dealing with acne, perhaps throwing in a moisturizer that has BHA in it, or maybe mandelic acid. Mandelic acid, in addition to being an exfoliant, has antibacterial properties to it, so it's incredible for people who are dealing with acne. But then for prejuvenation in your 20s, again, it's sunscreen, using an antioxidant serum, and it doesn't have to be vitamin C. I feel like I'm always saying this, that whoever's doing the PR for vitamin C and for retinol, they're doing a really great job. But there's no one singular ingredient that is right for everyone across the board, because we're all so different. And so it's about finding what works for you, what do you like, what does your skin respond to. I, most days, don't use a vitamin C. I like using niacinamide. That's an antioxidant, but it's less talked about. Copper peptides, one of my favorite serums by Allies of Skin, copper tripeptides, it has antioxidant properties to it. Resveratrol is another one. And so adding that in the 20s, that's going to help to protect you from oxidative stressors that can accelerate aging and cause those signs of aging to happen.
Can I just jump in here that we start losing collagen in our mid-20s, and we lose about 1% of the thickness of collagen every year. And so to answer your question as far as when you should truly start acting, I would say at least in your mid-20s would be a good time, because that's when the collagen starts to degrade. And just some of those things you're talking about with copper peptides and things, that's going to help to stimulate collagen production. And then women, this is really depressing, I'm going to tell you, In the first 5 years after menopause, studies show women lose 30% of the thickness of collagen in 5 years after menopause, and then about 2% every year after that. And so, yeah, I'm sorry, it's depressing. But it is what it is. And so I think, kind of fighting that collagen degradation, which is one of the main factors in aging of the skin, that starts in our mid-20s or so. So starting with actives, at least by that time, I think is a good time.
What about something like stem cells? I was at a dinner last night, and we were talking a lot about this because there were people at the table who inject stem cells in their face, and they look incredible. So what is the efficacy of that and the safety, and where is that going?
So the idea basically, the idea behind stem cells is stem cells are cells that are so young that if you put them in a certain part of the body, they will turn into that body part, essentially. And that's why we talk about people who have cancer and they have to, let's say, undergo removal of cancer. The idea is that you can technically, ideally, rebuild organs with it. As far as cosmetically, our fat is chock full of stem cells. So for years, some doctors have talked about injecting stem cells as part of like a facelift. And same thing, the idea is to rejuvenate your skin, rejuvenate your tissues. Legalities right now with stem cells are kind of murky. It technically is not against the law to inject stem cells in the United States, but it is against the law to advertise that you're injecting it for a medical purpose. Does that make sense? So there are doctors who are injecting it, not a lot because there have been so many offices that have been actually rated by the FDA and stuff like that, that it's a questionable thing. For cosmetics, I think we're trying to get around it by looking at more of the exosomes instead of the stem cells. So it is something, I think it's the future of medicine, but regulation right now is kind of in the way of some of that, which understandably, because it was the Wild West for a while with stem cells, where you could probably open up papers and see all these ads and stuff for it. But eventually, I think right now what we need to get is the FDA clearance for exosomes. That's going to be much easier, more directed than actual stem cells. And we're not quite there yet.
Okay, so a lot of these things that we're talking about are amazing, but probably not attainable for most people. So when it comes to things that we can do at home, I would love to just talk about the efficacy and legitimacy of things like LED light, that's having a moment now, microcurrent, at-home microneedling, things like that, face tape, just kidding. Gua sha, there are so many things that we can do at home to support our skin, so which do you like?
Do you want to go first?
I love red LED. I've been using it for years. Studies show that it helps to reduce inflammation and help with inflammatory skin issues. But what I like about it the most is it is so incredibly easy to use, because whether you buy, a skincare product or a skincare device that's $10 or $400, if you're not using it consistently, it's not worth the money and it's not going to work. So I love that I can just strap it onto my face and lay down and scroll for 30 minutes, and it's incredible.
There are studies that do show that frequent use of red light therapy can increase collagen and elastin in your skin. But you do have to do it for a couple of months. So I do think that that's a great bang for your buck. Like, bang for your buck, definitely LED is really good. The other thing I think that's bang for your buck that you can do at home is at-home microneedling. But it's not with the rollers, it's stampers, dermal stampers. You may have seen ads that I'm in on social media promoting one of the brands. And it does work. And actually, the funny thing is in my office, we have something called the Gold Filtox Facial, where it's the exact same device that they sell online, but we put a combination of Botox, filler, and growth factors, and sometimes PRP into it, and we inject it, and it costs like $800 in my office. But you can get that very similar thing at home, and they'll give you certain serums and ampules that you can use for your skin. It's almost exactly the same device as we use in the office.
They have liquid microneedling now at home that you can do that has the spicules that are derived from those marine sponges, and you can pair it with a growth factor serum or a serum that has exosomes in it and apply it topically at home. It's not going to be a one-for-one of what you're getting in office, but it definitely is going to be more of a boost than just doing a regular cleanse, 3-step routine.
And doing like microneedling also can help. Like one of the things I'm trying to do is thicken my hair. And so if you microneedle your scalp and then you apply, even if it's Rogaine or if it's like a normal serum, you can do rosemary oil, that you're going to get better penetration and you're going to see better results.
And Amy, you're a big fan of the RLE Shot, right? So that's,
I love it.
explain what that is to
Yeah.
the audience.
So the RLE Shot, it's from a Korean brand called VT Cosmetics. And what they do is they source these marine sponges. They're these little spicules. They look like little needles. They're microscopic. You can't see them, but you feel them when they're applied to your skin. They go through a process of turning them translucent so they can ensure that they're not contaminated with anything, that they're completely pure. Then they mix them with other ingredients like Centella asiatica, which has been shown to help soothe the skin, soothe redness. They have other ones where they combine it with retin A. And so what it does is it creates this open channel, and it allows for the skincare that you put on top to penetrate deeper, and then it closes up. And what happens is over the 72 hours, your skin will shed, and then the top layer, those little tiny spicules, will eventually turn over and push out, and that's how they get out of your skin. But it helps to stimulate collagen, and it really helps with delivering ingredients deeper. Our skin is a barrier. It's meant to keep things out. And so one of the things that skincare companies are always trying to do is they're trying to figure out delivery systems. Those are the things that these skincare companies are patenting. And so this is an incredible advancement because it helps to get things deeper into the skin so that they can be effective.
I'm sure we could keep going.
This is so
Tell
fun.
everybody
Thanks,
where they can
Thank
find you.
Thanks, everybody.
You can find me on Instagram or TikTok at Amy Chang.
I'm also all over social media. I have my own podcast, The Dr. Yoon Show, and you'll probably see me all over the place on fake AI videos using me to sell crap that you don't want to buy. So
Thank
don't buy
you.
it, please.
Thank you both.
Thanks, Ariel.